I'm so excited to have you guys all here today. My name, if you guys don't know me, is Amanda Hoff, and I am the Relationship Development Specialist here at Support After Abortion. We're going to be talking about the topic of the power of collaboration today. Collaboration has been something that I've been super passionate about. I feel called to be a connector. So connections and relationships and collaboration are kind of my jam. I've really embraced that and been passionate about that in a lot of different arenas throughout my career. So a little bit of background about me. As the former client resource director at an organization that helped with homeless young adults, I have created resources for our clients and also worked to collaborate and build relationships with other organizations that could provide resources to benefit our clients there. We had this big list of resources that we would give out to our clients, and it was probably 15 pages stapled document with all these different resources and organizations that our clients could connect with to get help. But I found that to be really overwhelming, not just for my clients, but also for myself, because I wasn't aware of all the different services each one offered. I didn't know anything about their intake process or the requirements of their programs. And so one of the things that I really sought to do as the director of my center is to reach out to those organizations, to build relationships with them, to learn more about the services that they offered, and to also share with them and bring awareness of the services that we offered at my center so that we could collaborate and have that relationship to be able to have those warm handoffs between those organizations and mine and for our clients. And so now here at Support After Abortion as the Relationship Development Specialist, I get the privilege of collaborating with you all and with other organizations as being my primary focus here. And so a little bit about our mission here at Support After Abortion. One of the three main pillars of our mission statement, as Heidi, if you could click to the next slide. I'm sure you're real busy trying to figure out other technical issues. Okay. So if you click the slideshow there, then it'll probably do your mains, like the whole screen. There we go. All right. So one of the main, and sorry for all the technical difficulties, guys, but we'll just keep rolling with it. So one of our main pillars of our mission statement here at Support After Abortion is promoting collaboration. And of course, we want you guys to be collaborating with us, but it is so much more than that. We want you guys to be collaborating with each other, with other abortion healing providers, with churches, with clinicians, with other organizations in your community. Because we know that there are potentially 22 million people out there who are hurting, who need healing, and none of us individually can serve that many people on our own. And so if we're going to reach all of these people and we're going to start a healing revolution in our country, which is my vision, which is Support After Abortion's vision, then we're going to have to work together to be effective. And that's why I really love this African proverb that I came across. And it says, if you want to go fast, go alone. If you want to go far, go together. And I feel like that speaks so beautifully to the power of collaboration. And if we can set aside our own individual numbers and our own agendas and our own, even our differences, right? And we can embrace this idea that we're all in this together and we're working together, we can bring healing to so many more people just by simply collaborating and working together. So now that we've kind of set the stage for what we're going to be talking about, I want to talk a little bit about some of the benefits of collaboration. One of the benefits of collaboration is the ability to offer options. So in collaborating with us, you can receive training on how to offer other options that you may not be currently offering. And as you may know, we're very passionate here at Support After Abortion about option-based healing. And there are a lot of different options to be able to meet clients where they're at. And we offer training on how to offer some of those different options, like virtual healing, men's healing, secular healing. But also, if by collaborating with other organizations and other providers that offer options that you don't, you will have the ability to refer to those agencies when you have a client that is looking for a type of healing that you don't offer. Because I recognize, again, as the former director of a pregnancy resource center, we can't do it all. And so if we can work with others that offer other things that we don't, we have the ability to meet our clients in such a more holistic way that meets them right where they're at. And then that also helps us to build capacity. So collaborating with other providers helps us to have somebody that we trust to refer to when our programs may be at capacity. But also by collaborating with us and other providers, you can receive referrals to help build your numbers if that's something that you're struggling with. And so it really can work both ways. And then one of my favorite parts of collaboration is the support and encouragement that comes along with it. And I get the privilege of being able to support and encourage the providers that I talk with and meet with every day. It is one of my favorite parts of my job. But you guys can be supporting and encouraging each other. If you're building those relationships with other providers that are inside and outside of your community, it just really helps you to know that you're not in this alone. I know personally in conversations that I've had with other providers, something I hear quite often is that they feel really alone in this work, or they feel like they're on an island by themselves. Or, maybe they don't feel like they're a high priority in their organization. And so they don't feel like they have the support and encouragement that they need. And if that's you, I want to be the one to support and encourage you. But I also would love to see us as people who are working together in this healing movement to be a source of support and encouragement for each other. And all of these things work together to decrease burnout. By having more capacity, by having the support and encouragement we need, by being able to offer options, by receiving referrals when our numbers are low, or giving referrals when we're at capacity, we can decrease burnout. Because I know that this is not easy work that we all are in and doing every day. This is a hard space to be in, but it's so needed. And we do often see high levels of burnout when we don't have these benefits of collaboration. So now we talked a little bit about the benefits of collaboration. Let's talk about some ideas of different types of organizations that you can collaborate with. So this is obviously not an exhaustive list, but this is just going to give you some great ideas of places to start when you're looking to collaborate. So as I said, we would love for you to collaborate with us. And we have a plethora of different ways that you can do that. And so we'll go over some of those in more detail. Another great type of organization and person to reach out to for collaboration are clinicians. And there are really great benefits to partnering with clinicians in your community. One of those being that if you have a client who is struggling with an issue that may be outside of your scope, that you have built these relationships with clinicians in your area. So you have a list of trusted clinicians that you can refer those clients to. And then also by having those relationships with clinicians, some of them may even be willing to set up a sliding scale for their fees for clients that you refer to them. Another great way that clinicians can be a resource for you is by offering training and resources for your staff and for your volunteers. I know here at Support After Abortion, in our seeking to learn more on how to work with clients who call into our after abortion line who may present with suicidal ideation or struggling with suicidal thoughts, that we collaborated with a clinician who is an expert in the area of suicidal intervention and bereavement, and received training from her. And just a sneak peek, I'm really excited about this, but you guys will actually get to hear from her in our April Healing Provider webinar, because we're hearing from a lot of the providers that we work with are also seeing more and more clients come to them with this issue. And then, of course, we have our amazing Lisa Rowe, who is our clinical strategist here at Support After Abortion, who just pours into us with so much knowledge and resources and training that have been so beneficial for us. Another great space to collaborate with are intersecting agencies. And intersecting agencies might be an unfamiliar term for some of you. And so in short, what an intersecting agency is an organization in your community that is intersecting with a large number of people who've been impacted by abortion. And there are a lot of different types of these organizations. And so I'm going to go over that in more depth here in just a minute. And then again, we want to see you collaborating with other abortion healing providers. And I've heard from some of you that you have great relationships with other pregnancy resource centers in your community. And I think that that's wonderful. Again, we're not in competition. There are so many people who need our help and our services. And so if we can, like I said, work together, we can reach so many more people. But also we can collaborate with providers that are outside of our area. And a really great tool that we have to utilize to help you do that is our abortion healing provider directory. So on our directory, you can search for the type of healing that your client's looking for, if they are looking for something that you don't offer, or if they're in a different area, or if it's a man and you're not currently offering men's healing, you can look for men's healing. So it's a great tool for you to utilize to find providers that may not be in your community, but maybe they offer virtual services that you could plug in and refer your clients to. It's also a really great way to collaborate with us, because we use our abortion healing provider directory to connect the clients that call into our after abortion line with the type of healing service and provider that they're looking for. And so if you're not a part of our directory yet, we would love for you to join us in that way. And I would love to meet with you and talk more with you about how to get your listing created. And if you are already in our directory, just a heads up, we are going to be refreshing and reviewing all those profiles in April. So just keep an eye out for communication about that. And then going over some of the ways that in more depth that you can collaborate with us, we have a ton. And I know if you guys have had a meeting with me personally, it can get overwhelming because I get so excited about all these different things that we have to offer. But I always remind the people that I'm talking with that just as you guys are trying to meet clients where they're at, we seek to meet you where you're at. So we don't want to add so much to your plate that it feels overwhelming. We want these things to be a benefit for you and for you to add them as it's helpful to you and as you have capacity to do so. So of course we have our webinars, which you guys are collaborating with me today by being here. So thank you for that. We just started, if you don't know, we just started our Men's Healing Matters webinars. And those are led by our men's healing strategists, and those are amazing. We have quarterly facilitator training webinars, which are more the nuts and bolts of healing and how to be an effective leader of healing. And then we even have an individualized coaching program where one of our expert facilitators will walk alongside you step by step on how to facilitate a Keys to Hope and Healing or Unraveled Roots group. And then again, we have so much, so I'm not going to talk about all of them, but our website has a lot of great training and resources available. Our Keys to Hope and Healing and Unraveled Roots facilitators trainings are available there. But also, if you didn't know, they are available on Bright Training through Bright Course. So you can get your facilitators training and offer those programs through that platform. And then we have our resource library that is just chock full of a ton of great resources that will help you and your clients. And then we will go on to talk a little bit more in depth about those intersecting factors that I mentioned. So research has shown that there are intersecting factors that come along with an increased risk of unintended pregnancies. And with that increased risk of unintended pregnancies comes a higher rate of abortions. And by reaching out to these different types of organizations, you can spread awareness to them about the fact that they are likely encountering a lot of clients who have been impacted by abortion, and letting them know that you are there to provide that healing and that resource for those clients who may disclose that to them. I know as an organization, we've had some really great luck with collaborating with mental health organizations, addictions organizations, domestic violence, sex trafficking. Those have been some really great areas to just bring that awareness. But then again, it's a reciprocal relationship, right? So by knowing about them and learning about them and their services, you guys can have that relationship to be able to refer to each other when you have a client who might be struggling with one of these issues as well. Okay. So now that we've kind of talked about the benefits of collaboration, and we've talked about kind of where to start and who to look to collaborate with, I'm really excited because I have a few people that I've asked to join me who have really embraced this idea of collaboration. And I just wanted us to be able to learn from them and from their experiences. And so the first person that we're going to talk to is Marley Ellenberg. And she is the Recovery Care Coordinator for a Pregnancy Resource Center in South Carolina. So Marley, are you there? Oh, I see your face. There you are. Hey.
Hey.
Hey, girl. So I am so excited to have you here. And I want first, for everyone who doesn't know you, for you just to tell us a little bit about yourself and kind of your role there at your center.
Okay, sure. This is actually my second time around in pregnancy care ministry, and I know a lot of y'all are probably thinking, "Oh, you came back." We all know how hard it can be. 12 years ago, I actually resigned as the executive director of the center that I'm currently sitting in right now. And during that 12-year break, I did prison ministry, women's ministry, just a lot of different things. And then just as of recent, I came back on staff to head up the recovery program.
Awesome. And I know that you are one of the people that I have collaborated with. And I know from our very first meeting that you really embraced the idea of collaborating with support after abortion. And I would just like to hear a little bit about your experience with collaborating with us and the things that maybe you have found beneficial in our relationship so far.
Absolutely. So 12 years ago, whenever I was doing post-abortion healing here at the center in South Carolina, there were so limited resources. Everybody was doing a particular Bible study, and we had some great training available, and that was wonderful. However, 12 years absence and then coming back on the scenes, and then finding support after abortion, finding your website was just such a treasure. I mean, everything that's available on the website in itself is so much, but then to have the opportunity to have bi-directional relationship. A lot of us in pregnancy care ministry, we're used to having those affiliates, and you might can email someone, or you might even be able to call someone, but you're not necessarily going to build a relationship. And from day one, I still remember our first conversation. From day one, relationship was established. And it's very much like what you were saying, recovery ministry within the context of pregnancy care ministry is a part. And it's very easy for those of us that are doing recovery ministry, because it may just be one or two of us. And then there's multiple others that are running the other part of the ministry. It is very easy for you to feel like it's all caving in on you. And so to be able to have these times of virtual visits of, encouragement from Karen or you, Amanda, has been God's saving grace, actually.
Wow. Well, I have really enjoyed our relationship, and you feed into me every time I talk to you as well. And so again, it's that mutual, the reciprocal relationship. And I learned so much from so many of you guys that are here on the call today. And so I'm so thankful that we have that opportunity, and that Support After Abortion does want and encourage those types of relationships and collaboration. I also have talked to you and heard a little bit about you are now collaborating with some other organizations in your community that have been really interesting. And so I was wondering if you could tell us a little bit more about that.
Sure. One of the most successful collaborations that we're having right now are recovery homes, specifically drug recovery. We've got two different transitional homes in our area. And transitional homes, drug recovery, are usually pretty overwhelmed because that's a residential setting. So to be able to provide everything that their participants need is a lot. And so to be able to come alongside of them and partner with them to be able to offer some of the classes that they need has really been a blessing. And the women, the participants, gives them an opportunity to get out, come into the center to interact with other people. And that has been really, really successful. Luckily, I sit on the board of our local drug recovery agency. And so that gave me an easy in as far as being able to make that connection. But then I also utilized some of the connections that were already available here at the center, because after 30 years of service, we've become recognized for our services. DSS, which is our Child Protective Services Agency, they recognize our programs. So that opens some doors as well with our recovery community.
Yeah. So I think it's great that you already had those relationships established, and some of those that you've reached out to. Can you kind of give us some advice on how we might be able to approach collaborating with organizations in our community, or some tips that have been helpful for you when you're reaching out to build these types of relationships?
Well, I think honestly, Amanda, you've said it, and not only have you said it, you've modeled it. The reason why Support After Abortion captured my attention is because of the way y'all do ministry. Y'all do ministry relationally. You're out to build kingdom, his kingdom. And so there's no, we're up here, you're down here, like we're peers, we're sisters and brothers in Christ working together. And so I think y'all have provided a fantastic model. Anybody that has interacted with y'all, not only receiving the benefit of it, but also learning as well. And so I think if we continue that approach, if we can continue that waterfall effect of approaching people that way, in a lot of communities, there's mixers, there's chambers of commerce, there's all of those things. We're located in a downtown area. We make sure that we're out and about in our community, not just at meetings that affect us, but other meetings. We were at a meeting actually at the beginning of the week that was about anti-human trafficking. and we were able to connect with people. You know, if you want to connect with people, make sure they see your face in the community. There's all kinds of different things. So just get on your community's website, get on their Facebook, and find out what's going on in your community. A lot of times in pregnancy resource ministry, especially, sometimes we have a tendency to stay in our office, to stay behind closed doors. Open the door, walk outside, and begin to introduce yourself. It really makes a difference.
Wow, that's amazing advice. I think it's so true. I remember, yeah, when I was in that space, I felt like we were kind of in our own little huddle and only going to meetings that were for pregnancy resource centers and not really getting out there into the community. I think that is amazing, amazing advice. So thank you so much, Marley, for sharing your experience and what you've learned. And we just really appreciate you being here today. So thank you.
Absolutely.
All right. So the next person that I am going to be talking to is Deetra. She is from a pregnancy resource center in New York City. And so Deetra, there you are. Hi.
How are you?
Good. Thank you so much for being here today. Let's just, if you want to introduce yourself and just tell me a little bit about the abortion healing services that your organization offers, because I know you guys do offer a lot of different options. And so I would love for you just to share a little bit about yourself and those different healing services that you guys offer.
Awesome. My name is Deetra, as she mentioned, and I am the director of HOPE, which is our after abortion support program at Avail. And I also want to introduce that my boss, our director of relationships, are here as well, Chelsea, and she's going to chime in and help out with this conversation a little bit. But we stand in the space where we're here to support people in all aspects of their processing through unexpected pregnancies, parenting, support services. HOPE specifically focuses on after abortion care. And in our HOPE, we offer a series of programming and offerings. We have a weekly meetup where people can just drop in. There's no commitment. They just get online and they come around and we talk. And it's like, hey, I'm having a rough week and I just need someone to talk to, and we just never know. It's a popcorn event. We never know who's going to be there, and it's really beautiful and it's really a blessing. We also have our one-on-one advocacy program where we meet with people. We have volunteers and staff advocates who meet with clients one-on-one. There's never a cost for any services. They meet with us for as long as they need. We have clients who have literally just left an abortion clinic to women who are still dealing with it 10 or 15 years later and are feeling triggered or having some issues and challenges. And they can come to us and get our services free of charge. And then we have a 9-week support group that we offer, and that's a full curriculum that women go through, and it's really a focused program, and it's super healing and wonderful for the women to go through this program. And it's just really amazing to see people on the other side of it. That curriculum is something that we do internally, and we also train others to do as well and promote that. So those are a quick offering. We also have a men's program that is growing by leaps and bounds, and we love that as well. So we just try to stand in the gap and be what people need as they face unexpected pregnancies and often on the other side of abortion.
Wow. Yeah. And you guys do offer, I love hearing all these different opportunities for healing and the different types of healing that you guys offer. And because you offer, so some unique options like men's virtual Spanish, right? One-on-one and groups, that has led to us, having the ability to refer some clients to you who have called into our after abortion line. And we've had some great experiences with collaborating with you in that way. I would just love to hear from your point of view, what that's been like for you to be a part of the directory and to receive those referrals, and what that experience has been like.
Yeah, it's been a really beautiful experience. I have a lot of experience in the nonprofit, and so I'm just a great proponent of let's work together, let's be non-duplicative and help each other along the road. And the experience with you guys has been amazing, from the point of referrals from your side or from us just calling in and needing help updating our directory. You guys are just great and wonderful to work with on, every aspect of that. We've had really good referrals from your organization as well. We've had people take a part of we had a young man, I believe, from Mexico City looking for Spanish resources. We had people take advantage of our 9-week support group and, just on and on. I think in February, we received 8 referral connections from you guys, and that was really amazing. We're new kids on the block with you. We've only been around since June of last year, and I'm newer as well in the role. So I'm just coming up on a year in the role. And so we're really hoping to even grow that collaboration in the future. But I will say it's been really beautiful since I've been here, and we're really looking forward to see where it goes.
Well, it's been, like I said, it's been a great experience for us too. You guys have been so, responsive and, when we've ever had any questions about your services, just being so transparent and helpful and willing to jump in and to serve those clients. So we appreciate that. And I know that you guys, in talking with you, I learned about some other organizations and different collaborations that you have at your center that have been really beneficial for your clients. And so I don't know if it was Chelsea going to jump in and kind of talk a little bit more about some of those other collaborative efforts that you guys have embraced and what that experience has been like for you.
Sure, Chelsea, go for it.
Thank you all so much. It's an honor to be here. So Avail looks at our partnerships in a couple different ways. We have some very established partnerships, and then we have a lot of different referrals. But one of our established partnerships where we refer to them and they refer back to us is a medical service partnership. And so the name of that service is Beacon, and we're able to refer clients to Beacon for free or low cost OBGYN services. And so that looks like not only ultrasound or pregnancy confirmation, but also after abortion wellness appointments where someone can come and talk to the doctor about that experience. And so Beacon really takes pride in providing excellent care that focuses on our clients' medical concerns surrounding an abortion and providing a safe space for them to talk about any questions that they have, including asking what symptoms are normal, what's not normal, and other mental and physical health related concerns. And so we're really grateful for that partnership and the ability to offer that to our clients. Another collaboration that we have, I know, Amanda, you mentioned earlier collaborating with mental health providers, and that is something we're seeing more and more. Our clients that are coming for after abortion support, they also have often clinically complex needs for therapy. And sometimes it's exacerbated by the abortion. And sometimes they're finding, it can be interconnected, but we offer a counseling subsidy to an approved list of counseling providers in the New York City area, and building that to virtual as well, where we can subsidize counseling for our clients so they can have a therapist alongside the services that we're offering them.
Yeah.
Wow, those are amazing assets to have, and I know I would have been jealous of that of all of these connections that you have when I was the director of a center, and I would have the question, how did you do that? Like, how did you build those relationships, or what are some steps that you can share with us about how other providers might be able to make those types of relationships and connections with medical providers and clinicians?
Yeah, I think I'll let Chelsea jump into the tactile side of it, but I think it's really important to call out that Avail is a faith-based organization, but we ascribe to the third way. And so we proudly stand in the tension of, we just want to be person-centered and trauma-informed, and that's what we're here for. And so because we sit in that authenticity, it makes it very easy to connect with people that you wouldn't think we connect with. We're with faith-based, we're with medical, we're with clinical, we're all over the place, because for us, it's just about providing the best possible care we can and giving and meeting people where they are. For Hope, we endeavor that no one ever has to walk the post-abortion journey alone, period. And even though we are New York City based, we are digitally based as well. So a vast majority of our programming is really digital and virtual right now, so anyone can access it. But I'll let Chelsea jump in and give you some concrete steps to creating that grassroots connections.
Beautiful, Deidre. Thank you so much for sharing that.
Yeah. I don't have any super, insight. It takes a long time to develop some of these connections. And so those are things that I know our CEO of Avail has been working on for a long time and leveraging those connections. So I think it's just asking questions, having conversations with people, and seeing who you can find that believes in your vision and mission and can serve clients with the same heart that you are serving them in your centers. And so all that to say, it takes a long time to build some of those connections. I know specifically the medical connection, that is something that has been in the works for years before we even had that established. And so just be patient with that as well would be my encouragement. And I'm happy if anyone has specific questions about you kind of what that really looked like. I can find more information and connect you with those who helped establish those connections along the way.
Thank you so much for that, Chelsea. And thank you so much, Deetra and Chelsea, for your guys' willingness to be here today. I think that we've learned a lot from you. And I'm actually really glad that you kind of brought up some of those medical collaborations that you have had, because my next person that I want to talk to is actually a social worker at a major hospital in the Washington, D.C. area, and her name is Yolanda. And so I'm really excited to have you here today, Yolanda, to learn a little bit more from a different perspective about collaboration. And I know that we have been collaborating on a project that you're currently working on at your hospital and for your staff. And so I would love for you just to share a little bit more about this project and about the need that you saw to start working on this project.
Yes, hi. So good afternoon, everyone. Since the overturn of Roe v. Wade, we noticed a surge in abortion cases on our service where patients either presented with a ruptured membrane, meaning that their water broke, or they presented post-delivery with the fetus or had difficulties at the abortion clinic and was sent to us. And several patients reported that they did not receive after abortion care support resources. Since this was uncharted territory for us, we recognized that there was a need to develop a template. And so I took the initiative to create an aftercare abortion program that includes creating a door card that we place on the patient's door that alerts the team to be mindful of the patient's experience when entering the room. We also created a footprint card for patients who desire footprints as a keepsake, and a healing note card that the team can sign and give to the patient at discharge. We also pre-assembled resource folders that contains the resources from support after abortion. So we're so grateful for that because, again, prior to this collaboration, we didn't have any materials.
Yeah, and it's been so exciting to me because, I know we talked about how amazing it is that by giving this training and these resources to your staff to give to patients, that really the healing can start right there, rather than it causing, even more trauma potentially. By having informed staff that are trained, that you have resources to refer to them, that really kind of can kickstart that healing journey for those patients. And I just think that that's such a beautiful thing. So can you tell me a little bit about any aspects of our organization's mission or approach to client care that resonated with you, that you thought this would be a good place to collaborate with?
Yeah. Well, we realized that the patient's hospitalization was beyond her control or ability, right? When the patient made the challenging decision to terminate the pregnancy, she did not believe that it would lead in hospitalization. And as a hospital, we have a moral and ethical duty to provide medical care to all patients, regardless of their circumstances. Our hospital stands for inclusion, diversity, and equity, where all patients are treated with compassion, regardless of their situation. And so for us, we looked at it, from the perspective of, while this is not in our wheelhouse, it's important that we collaborate with an organization that can help us in making sure that our patients receive resources that's tailored to their needs.
Yeah. And so I know that in this project, you have also maybe found some other organizations that have been helpful for this project. Are there other organizations that you've kind of been collaborating with to help these clients who've experienced abortion who are coming to your hospital?
Yeah, that part has been really interesting. Several nurses and I, we contacted a few abortion clinics to find out what resources they provide to their clients. And unfortunately, no one responded, which was just mind-bending. But I have to say, yesterday, one of our nurses was finally able to penetrate the walls of one of these clinics, and they did share their resource list, which we were grateful for. But after reviewing the list, I noticed that the clinic combined all types of losses, such as perinatal loss and abortion loss, into one resource basket. And as you know, perinatal loss, meaning a miscarriage, stillbirth, neonatal death, chromosome abnormality, is different from abortion loss. And so while we, again, were grateful for that resource list, we knew that it would not be applicable to our patient population. So again, going back to how we are grateful for the resources that you provided, because we find the Keys to Hope and Healing booklet, the client healing card, center card, and the resource card, just to name a few, to be extremely helpful for our patients.
That's wonderful. And I just like Chelsea was saying, right, about sometimes it's a little complicated for us to know how to approach building or bridging this gap or building these relationships with medical providers. I'm so excited that you're here because we can kind of pick your brain a little bit about what would that look like? How could we, as providers of abortion healing, be effective in reaching out to and building collaborations with hospitals and other medical providers? Do you have any tips for us on how we might be able to do that?
Yeah, every hospital is unique. It could be maybe just starting either with the emergency department or the labor and delivery unit, because that's going to be the points of entry, right? The ED, emergency department or labor and delivery, and just letting them know, who you are and that you are here as a resource. We, recognize that you may see an influx in patients and may not know what's available. And so we are here when you're ready.
Yeah.
Yeah.
Well, I just loved your heart because you said, when I have a patient that comes in, my job is to make sure that they have the resources that they need, that they feel supported, that they feel cared for. And you have also, you developed your perinatal loss program at your hospital and shared with me. Then you were seeing this and you knew like that you didn't have the resources that you needed to serve those clients, and that you've taken this huge initiative. It's a big project. What have been some of those the challenges that you have kind of come up against as you're trying to implement this program? I've heard that you said a lack of applicable resources out there. But what are some other challenges you've faced in kind of starting this project?
Yeah. We have a robust perinatal loss program, which I'm very proud of. It's the program that I kind of built from the bottom up, and it's about 16 plus years old. And so it's quite an accomplishment for us. And now here we are developing another program in aftercare, an after abortion care program. And again, initially it's still very new for us, right? This was not something that our service has encountered again in the years, and I've been with our hospital for 20 years, and so it's not something that we've encountered in terms of the volume. And so everyone was really at a loss, from bedside nursing, to myself, in terms of how can we provide this supportive care, because we recognize that it would be a disservice to, again, place perinatal loss and abortion loss into the same basket. And so it was really just having conversation with nursing. And one of the things that we've done is we've created a nursing checklist, which is a helpful guide for the nurse when she's providing that supportive and compassionate care. Again, I mentioned about the door card and footprint cards and so forth, and the resources that we're able to provide. But for many members on the team, it was really a sense of distress, uneasiness about we don't know what to say, what's appropriate, we don't know what to do. And so when I formed this working group with me and 3 other L&D nurses, it began to ease some of that distress, knowing that help is on the way and that we have a program that we're going to roll out, in the coming weeks. And we're also looking forward to an upcoming presentation that you and your team will provide to our team, which will also be really helpful. So thank you in advance.
Well, I've told you from the time you called me how excited I am about this opportunity and about this trail that you are blazing and this example that you are setting for other healthcare providers and the doors that you could be opening to make sure that that patients are receiving that type of care. So I'm just so thankful for all the work you're putting in. And so thank you so much for being here today. I know we've all learned a ton from you.